Okay, welcome everyone. I'm going to find Joel on here so that I can make sure that he can speak. We do these weekly calls. I've seen many of you on them in the past. And we do this just to touch base and exchange information and to allow you the opportunity to give Joel and I our marching orders about what we should be doing to advocate on your behalf. This call has directors and staff and parents, so we're all in this together on this. I have a couple of announcements at the outset here. One is that I have muted you all. If you would like to unmute yourself, you are more than welcome to do so. You just have to hit *6, or if you go to the corner of your screen, you can unmute yourself by hitting the button there, or you can go to participants and you can do it from there as well. So we're happy to do that. We also have the chat, and people are always very active on the chat here, and I monitor that and read the chat as well as part of this conversation. I sent all of you an email this morning as usual, and it has a lot of links to things that are going on this week and every week. I want to draw special attention to tomorrow. We have a call with Senator Murray's staff. I think we're going to have her committee staff, her office staff, and someone from appropriations as well to talk about Head Start issues and childcare. So I invite you all to join that. We also have a really great webinar for parents. Every Monday we have Strengthening Families, which is great for parents and staff. But on Friday, we have Devin Stubblefield, who many of you have met at some of our meetings because he does financial literacy for many programs. We've used him in the past for parent ambassadors, and we've brought him to our meetings, and parents absolutely love him, and he knows his stuff. He is doing a session on Friday that is we will have in both English and Spanish around financials during this time of pandemics. So how do you manage your finances when you're in a financial crisis? So I invite you guys to share that with your families. And let's see here. We have a lot of meetups for staff during the course of the week where people can share information. And I also want to draw your attention to the Department of Children, Youth, and Families, who has set up their base camp platform where teachers and family support and all of the kinds of staff in Head Start and ECAP and Early Head Start can share information, and they have some weekly meetups as well. So we may end up consolidating that work at the end of the day, but at the moment you can see the meetups that we have scheduled for the week. And I think that's it for announcements. Oh, the other thing I wanted to mention was that we are raising money. We hear a lot from parents and from staff about the challenges that families are facing right now as they lose their jobs and they can't figure out how to buy diapers or other things. And so we're just trying to find another avenue for people to give money, and we will pass that on to local programs directly and without any cut off the top. Of course, we really are so amazed at the work that you guys are doing with families, and for all of you parents out there, keep up the good work too at home. So I'm hearing over here in the chat that Basecamp is not accessible for some subcontractors, direct service staff, and that's actually one of the reasons why we are still doing teacher meetups and family support meetups, because I know that it's not widely accessible in some places. And so I have a meeting with DCYF this week to talk through some of those issues, to see what how we want to go forward. And I don't know how long this is going to last. So we will get back to you on next week's call about that as well. All right, Joel. Are you there, Joel?
I am. I was texting Melanie. Hi, everybody. I'm glad we have a good turnout. I think this is the most number of people. We have about 100, looks like over 100 people have decided to join us. Thank you. As Katie said, I really encourage you to come to our conversation with Senator Murray staff tomorrow. The appropriation staff is going to be joining the call too, as well as Lila from the Help Committee. So I think that'll be absolutely worth your time to join us, because that's an opportunity for us to talk about some of the funding needs. They are having some conversations about the next relief package. So so there's some opportunities there to try to get some more resources for both Head Start. What I've heard from the National Head Start Association is a need for more mental health supports and some more for some technology needs. And then I think the biggest funding request is probably around childcare subsidies. So we had a meeting with our coalition and with Representative Jayapal's staff on Friday to start the conversation about the needs in Washington. But we're going to be doing more of that. So most of our federal advocacy is around pushing for more funding for childcare. I think that's our biggest push. And the other way to look at it too is not only do we need more childcare support, but every dollar we get for childcare makes it less likely that at the state level, the state will look at cutting things like ECAP or other social service programs like TANF or other things. So it's really critical for the federal government to come in. You know, the longer this lockdown continues because of the coronavirus, the less likely that is for us to continue to have revenue coming into the state. And if the state doesn't have revenue, it means that they'll be looking at a special session in the next few weeks or a couple months where they're likely to look for more cuts. So it's going to be critical for us to advocate both at the federal level to make sure dollars are coming in. And then at the state level, what Katie and I are going to be doing is really trying to tell the story of ECAP in the way that we just try to tell the story of Head Start, which is what are ECAP programs doing during the coronavirus pandemic to support families. And so we're going to be really spelling that out, especially the modified services that you guys are doing. And in the cases where you guys are open, we're going to be trying to tell that story so that we're well positioned, both from a defensive standpoint of making sure people know what we're doing and the urgency of our work, but also potentially to ask for new dollars for ECAP during a special session. So that's our plan going into it. Trying to think of what else, Katie, is useful for people to. We've had some questions on DCYF and childcare. As you know, we've been advocating at the state level to make sure that childcare providers are paid out if they choose to close. So we're going to be continuing to advocate for that. So thank you for some of those questions around that area. And in addition to that, we're also going to be working on some issues around food assistance. So food stamps and WIC, because we're trying to increase the amount of food stamp offerings for people. But another issue that came up recently is whether people could use their EBT cards online. And there are some stores that allow that. Amazon, I think, is one of them, in Walmart, but not all providers allow parents to use food stamps online. And there's also a lot of states that don't allow it at all. So there are a number of issues even beyond early learning that we're keeping track of as well. So just wanted to mention that. That's a lot of stuff to take in, but know that we're continuing to advocate at both the federal and state level. And then at some point, we want to have a conversation more with you guys too about philanthropy and what areas we could try to raise private dollars to help support families. So that is it. And I'm going to try to speak more quietly because I'm working inside today, not in my office outside, because I may not be able to get back in. So, but as a result of that, I have to be quieter. So I'm getting that.
Yeah,
So.
I would also add the conversation around the next federal COVID-19 package looks like it's kind of boiling down to whether or not this next package is very tightly focused on small business or whether it more broadly supports relief for hospitals, states, municipalities. And then there's another question around domestic violence and to what extent the we need to intervene to slow the increase in domestic violence, which they're seeing in a lot of places, including here. So, so the work that you guys are doing is super important on that front as well. We have a couple of questions on the chat. One is it too soon to ask if we have any indication of what Governor Inslee is going to do about lifting or extending the stay-at-home order May 4th? I don't know. I don't think either of us have any idea, but it would not surprise me to see that extended, but we have not heard anything about that. Nancy Trevina asks if the child care subsidy will be, so right now, if you are on the child care subsidy, you are sort of guaranteed payment for your enrolled children, whether they show up or not, through April 30th. But that's not beyond that at this point. And so that's part of our state advocacy for sure. That's a huge issue for,
Katie?
Yeah.
I got an email on Thursday that said they were extending that until June 30.
Oh, great. The child care subsidy?
Yes.
So let me just add another little wrinkle on that. One of the, and this is something that we should all be aware of. The way I think, this is my read, so we'll need to ask another question, is that you can receive the subsidy for families who are maintaining their enrollment in subsidy, right? But if they drop out of the subsidy system, then you do not get that money. Simultaneously, the DCYF has made it way easier for parents to maintain enrollment in the subsidy system by waiving the copays. DCYF is paying all of the copays. So, but I do wonder for you guys, when you have parents who are, I don't know how this works, whether or not people are automatically staying on, or whether people are dropping off. And I wonder whether this is a bigger issue in childcare than it is in ECAP and Head Start, even when you're using the subsidy. Does anybody have any thoughts about that?
Katie, this is Nancy again. I don't think they've been really clear, and probably intentionally so, on if the families need to continue to be enrolled in both of those both our childcare and then also, the subsidy with Working Connections. It was pretty easy to do our March billing because pretty much the clients were the same, but I'm interested to see what the April billings will look like when they send those to us.
Yeah, well, keep us informed. If you have kiddos who are dropping off, whether it's because that's when their 12 months are up and the parents haven't, or I don't know whether I know that they are extending people as well. I just want to make sure that this is as simple as possible, and it's keeping you guys, whether you are childcare or ECAP or Head Start, as whole as possible, so that when we get out of this, we are not operating with a big hole in our budgets. Yeah. Yeah, so yeah, I'm sorry I did not clock that they had fixed the childcare thing. That's really great. The other issue around childcare is that they will only pay that subsidy if you haven't closed. So if you have closed without talking to them and getting a sign off from them for it being a health issue or whatever, then you may have more trouble getting that reimbursement as well. And we would prefer that to be a lot more liberal, as it is in 20 other states. Let's see here. Let's see, other comments here in the chat. Colleen Bance says the Birth to 3 Institute has costs for each session, but by any chance will we make these free? We don't have any intention of doing that at this point. I mean, maybe eventually the recording will be free. This is not an event that we are that we've been able to get free presenters for. So this is one that we're charging for, but we will think about that, Colleen, and let you guys know. There are scholarships available, so if you're interested in a scholarship, we have scholarships available, so send me an email. Mamie Barboza says, as food insecurities increase amongst families, we're hearing more concern from families about accessing food stamps and having a public charge against them. Is there any federal advocacy being done around this issue? Terrible position for a person to be in, torn between immediate need of food or future need for citizenship. Mamie, I think that's a really good question. I remember getting information about the specifically COVID-19 benefits are not tied to public charge, although if you're undocumented, you're not getting anything. But but this is a really good question, and that might be something that we want to mention to Senator Murray's staff tomorrow as well. Joel, do you know anything about that?
Katie, you're gonna have to ask me that again. What was that?
Food stamps. So there are families who are really struggling but hesitant to access food stamps because then they would have a public charge against them for immigrant families.
Oh, I have to do some more research on that. I know Maricela was looking at that issue about whether or not it would impact people during this time. I think there were some benefit programs that healthcare programs that wouldn't count toward the public charge.
Yeah,
that normally would, but I don't know about food assistance.
We'll double back on that and send you guys something out in an email.
Katie, this is Rika.
Yep.
Can you clarify something? I'm so confused about subsidy reimbursement. So is it our finance director, her understanding is that we would be paid for subsidy even if we are choosing to be closed, not because we've actually had an outbreak, but we made the decision to close. And that we would be paid for subsidy through April. Is that correct, or is that your understanding, or no? If we chose to close, not because we had an outbreak, are we being reimbursed for subsidy or no?
My understanding of the rule, Rika, and I mean, maybe I don't have this correct, is that no, they will reimburse you for subsidy if you remain open or if you are closed for a health reason.
Okay, thank you.
Yeah, so I would double back and talk to your licensor, talk to the ECAP folks. I think that this is really an open question, but my take on the way that they've described it in writing is that it is not generous. Regarding the public charge rule, Alan Warner has shared, an expert may say differently, but the way that I understand this rule is that it only applies to benefits received for the individual applying for residency, not benefits they've received for their children. Quote, the final rule also clarifies that DHS will only consider public benefits received directly by the applicant for the applicant's own benefit, or whether the applicant is a listed beneficiary.
I'm sorry, Katie, can you speak slowly?
Yeah.
When you read, thank you.
Yeah. The final rule also clarifies that DHS will only consider public benefits received directly by the applicant for the applicant's own benefit, or where the applicant is a listed beneficiary of the public benefit. DHS will not consider public benefits received on behalf of another as a legal guardian or under power of attorney for such person. DHS will also not attribute receipt of a public benefit by one or more members of the applicant's household to the applicant, unless the applicant is also a listed beneficiary of the public benefit. I don't envy Maricela trying to interpret the government gobbledygook on the fly. But this is also available in Spanish on there, Maricela. Maybe you can send it out to the folks who registered for the Spanish version.
I would just, Katie, I would add to that. I think that's absolutely true, but it still at the same point doesn't take the fear away that people have about using those benefits.
Yeah, absolutely. Yeah.
So it is absolutely true what that person is stating, and there are different exceptions for various populations too. But in practice, people are really afraid. I mean, part of our job is to try to help them not be so afraid. But we know this is an issue, and it would be helpful, whether it's Congress or the administration or whoever, would try to clarify some of these things now, so that, you know, I just read a story about farm workers in Yakima, and how that's a new area of concern, and how there's very little workplace protections, and there are people getting sick, and what benefits are they able to obtain or not obtain. So I think there's some more issues for us to dig into on this to kind of get some more clarity, because sometimes there are things that are right legally, but in practice they don't always fall that way. So maybe we can get some more clarity on this.
Yeah. Senator Wilson is on the call, and she says what she heard is that in March, April, May, they're trying to create flexibility in the child care reauthorization system to continue to authorize to keep kids in care when things start coming back into recovery. And Margaret Santalucia says you can also check on and share on the website coronavirus.wa.gov for information on state services for immigrants. Nancy Diamond says on ECLIC, which for the non-Head Starters out there is the Early Childhood Knowledge and Learning Center, which is kind of like the Office of Head Start website. There are answers posted to grantee questions on COVID-19 emergency funding that will be available. It talks about providing food, diapers, formula to enrolled children via delivery or other. Is anyone considering doing that? Nancy, I happen to know from my birth to 3 check-ins that there are programs doing that for diapers in the Seattle, South King County area. So yes, it's definitely being done. Anybody else? Okay, I'm trying to, all right, let's see here. Sandy Nelson, WSA is asking for donations to assist families. What process will be used in making decisions about the distribution of those funds? Yes, this is a very good question. Our original thought was actually that we would be giving them to the area from where the person is giving the money. And then beyond that, we haven't really thought through it. So if you guys have suggestions about how we should manage that, you know, sometimes we're a little ahead of our skis in terms of setting something up, but so far we only have $15, so it's not a major problem. And the $15 came from our website people because the donation system wouldn't work, and I was annoyed and was sending them mean emails. And so, so yeah, we will set up some sort of a system, but we haven't yet set that up. Let's see here. Nancy, I'm not sure what that refers to, how it's justified or how many. I'm not sure about that one. You can clarify if you want to unmute yourself. Tammy Lidster says that they have been distributing diapers and wipes. Sally Gundry says that they are utilizing informal networks and donations for deliveries of diapers, toilet paper, and food. All right, I think that's all the stuff we have on the chat. Oh yeah, and Michelle Murphy, she's down at Lower Columbia College. Shelly, they've been delivering diapers, wipes, hand soap, toilet paper, and limited food via advocates and teachers.
Katie, two things that I'm thinking about. One of them is I want to make sure people are cataloging all these things. You know, we just wrote something about Head Start and what people are doing with the modified services that they're using. I want to do the same for ECAP. But I also wonder, with Claire on our call, I wonder if she has a few minutes to just kind of give us an update about what's happening at the state level and what a special session might look like and what advice she might have to the group to help ECAP make its case. I wonder if you can unmute her if she's out there in the netherworld of Zoom.
Hi, how are y'all?
Hi, Claire.
Good, how are you, Claire?
Hi,
Thanks for joining us.
Hey, you're welcome. I thought I would jump on because I've been listening to a lot of folks, but just trying to figure out what the world of our state and federal funded programs look like. I've been having a lot of conversations around childcare, before and after school, summertime care, what's happening with online learning, distance learning with OSPI, and really concerned about our frontline workers, and that's our providers that have been in this business and been doing this work throughout this entire, you know, pandemic. Some still providing care, many not able to just because of their own situations, and they've got their own families, you know, to take care of and don't have access to resources that they need to be able to continue keeping people employed. So all of this is critically important. And, you know, initially I heard and I kept hearing, well, if we have a special session, and now it's really when we have a special session. So I'm assuming, and the last I heard, and it's kind of stuck around September, October, so the fall. But at the same time, you know, got to figure out how it is that you bring people together from across the state when in fact we're limiting our interactions and our distance from each other. So there's all kinds of legal issues that go into play the longer the stay-at-home order stays, in order to bring us back to potentially do the work we need to do. I think, you know, although one may have disagreed, these were tough decisions the governor had to make in his signing of this budget from this short session. And although ECAP didn't get the 5% increase that we had been able to push through, clearly, you know, his interest was not to decimate systems that we decimated in the past when we made short-sighted decisions. So for example, behavioral health, mental health, supports for kids and families. And so what they tried to do was maintain those kinds of things that would provide supports for kids and for families, and try to get rid of things that were new monies. Not that the new monies aren't needed. I'll just put that right out there. And I would imagine as we move forward, I just got off a call before this with Treehouse talking about their foster kids and about homeless kids. You know, we have needs everywhere, and we're going to continue to make some tough, have to make some tough
Excuse me,
budget.
Claire. Sorry,
Yes.
Claire. This is Marisela. Can you go a little bit slower, please?
Okay, I'm sorry.
Thank you.
Okay. I had just gotten off a call with Treehouse folks talking about the needs of foster youth and our homeless youth as well. And when we come back into session, whenever that is, one of the things we have to make sure that we don't do is what I was saying we did before, and that is decimate systems of support for kids and families across our state that we've still not been able to get back from the last recession that we had in 2000 and I think 7 and 8, whenever that was. And so I hope what you've seen is at least the first time through Working Connections, the 12 months authorization for homeless families, those things were not cut, they stayed. Our support even of our teen parents in our school systems are stayed as well. And the things that were cut were more things that had to do
Does Claire look frozen to you, or do I look
Oh.
frozen to Claire?
I'm glad that she's frozen to you too, because I wasn't sure whether I was the only one who had her frozen.
Sound has gone to Margaret says to everyone.
Margaret, can you hear Joel and I?
Yep.
Okay, so while we wait
I got
for,
kicked off. I'm
Oh,
sorry.
there she is. Hi,
oh
Claire.
good, here she's,
Yeah. So sorry. Anyway, I was, you know, I'm sorry. My little computer all of a sudden just said you're not on there anymore. You know, really, we'll have to think about what would it look like, because it would be again new money as opposed to existing dollars, and we're going to have. What we can't do is put systems pitting against each other, which we've seen over the years, whether it's K-12 and early learning, whether it's special ed and gen ed, whether it's human services and education. We cannot do this. It has to be an and both. And I can't tell you what that's going to look like or what recovery is going to look like. I can tell you we need to continue to advocate for supporting kids and families. And it's not about starting new programs. It's making sure that those that were in existence are able to come back into the fold. And that we are, again, solidifying this profession. We had come so far in our work around quality and all the dollars that we've invested in our state and federal programs, as well as in our whole early care and education system, that it would be so short-sighted to go backwards.
Claire,
But it may put us in a halt position for a period of time while, you know, we regather and recoup and kind of refigure out what a new normal looks like. But people are well aware in every single call that we can't do any kind of economic stimulus. We can do nothing if we have not a child care system in place for children to come to when families come back and go back to work. And you've probably heard the numbers too. We've lost about 20% of our centers have shut. And there's kids that are not at home that will need service and supports and care, because it's not if we go back to work, it's when.
Thanks, Claire.
Yeah.
Claire, can I ask you a couple questions just for some clarity to help? Thank you very much, by the way, and for your advocacy, both in the session and then of course now as well. But so I'll just lay out my 3 questions. One,
Okay.
do you think that, you know, there's a lot of people on the Zoom call, a lot of ECAP folks, in a special session, is it likely that we can advocate for a modest increase of funding, or are we playing defense? Question number 2, I'll just lay them out for you.
Go ahead.
Is revenue an option? There are some very wealthy people in the state who I think should probably share some of the burden of the budget deficit. And so I'm curious your thoughts on that. And then 3, what do you see when we go into a special session? What do you see as the main thing that either needs to be protected or boosted? I mean, of course, early learning and childcare, but I mean, what have been the conversations with lawmakers about we absolutely need to do more funding and protect this, as opposed? So those are my 3 questions. What should we be thinking and preparing for ECAP for a special session, revenue, and then this other?
I think the longer we go without, the less likely we're going to be able to advocate for new dollars. But I also think it's important to talk about the supports. As you've said, you've continued to be able to give to families, and you want to be able to support, because families aren't going to have less needs. Kids are going to have more needs when we come back into this. And I'll just say 4 years from now, we're going to have a boon of children, I think, unfortunately, that are going to be born.
That's not unfortunate, Claire.
And needing to have early learning services and supports. Just saying. Was on a call the other day, and for me, revenue is always a conversation, because that's really the only way we're going to change the trajectory of how things are happening around here. And this may be what it takes, although you think differently. I don't think a stimulus is going to be, an economic stimulus package coming from the feds is going to be enough, because of the global nature of the impact that this has had on not just a population, but the entire, population. No longer divided by if you have money or not. Even if you have money, you can't get what you need, you can't go where you need to go, and you can't find what you need to have. So, and I've talked to some stakeholder groups that believe now might be also the time for them in the first time to step up and to lead support in some kind of revenue generation. So that's always a conversation. And, we had planned on that kind of, or had planned for that this last session, although it didn't end up coming as a package of revenue for early learning. That initially was what the hope was. So definitely there's been work on that. That's not going to be lost. And then I think, the conversations have been around childcare and around the profession and the basic need that childcare provides to an entire economy. And had some conversations around the Association of Washington Businesses. Sometimes they have a hard time figuring out what their role is in this world of childcare, but this very much may cause them to understand how clearly the need for care impacts their ability to get back to work and to get to be productive again, because they're only going to be able to do that if children have a place for them to be cared for. Jobs, though, are a huge one, economic stimulus, and then what the nature of education is going to look like in whatever our new normal is, and how we're meeting the needs of our special learners, be they kids on IEPs, 504s, be they kids in institutional ed, be they homeless, or be they foster. It's a population that isn't often served well by a computer sitting at a table. And so, but I got to tell you, childcare is like huge. So I'll shut up after I say the last thing. Interim is when we go across the state, right? And we traditionally talk to stakeholders and talk about what's working or what isn't working. And so have been having conversations around this, and they're not going to be able to do that related to a statewide travel, but would love to have y'all as a group, a stakeholder group in conversation when we plan that, to talk about the impacts that COVID-19 has had, not only right now during your service delivery and what's been happening for kids and families, but also what that means for recovery as we move forward. So Katie and Joel, I'll stay in close connection with you so we make sure that that happens.
Thank you. So I would like to invite Nicole Lohr to unmute herself and give us any updates from the DCYF side.
Hi, everybody. This is Nicole Lohr from ECAP, Readiness, Innovation, and Capacity Manager. And I just wanted to share with you guys really quickly, for those of you that are on the ECAP Director mailing list, Karen sent out, Karen Gans, our ECAP Administrator, sent out an email, I believe on Friday afternoon or evening. And it was, part of it was the updated ECAP guidance, or our Q&A, that we are trying to update weekly if possible. And that should have come in a PDF form. And then the other portion of it was the piece around modified services. So we have a summary document, and I'm going to copy the link to it and put it into the chat box right now, because that's also up on our website. And what it does is it just summarizes the different areas of comprehensive services and how ECAP sites and contractors are providing services under each of those to families and to staff, you know, like professional development and all of that, how they're doing those kinds of services during closures of physical classrooms. And so these are modified services that are happening in lieu of regular classroom and family support services. So it's the initial document. We're definitely going to be updating it as we go along. There are also there's a lot of information being shared on the base camps. And just so you all know too, I know there's a couple of comments and clarifications around how direct services staff get access to that, and we're actively working with contractors to make sure that that folks have access to that. But you can see with the modified services document that just the incredible and really necessary services that are happening and occurring with families across the state in different ECAP programs. And we also have started putting in some links to kind of the top things that people are using. So you'll see some links. We'll continue to update those with, you know, as people keep sending us information and we gather more information from the webinars that we're having and the base camp. So just an initial document, but it really details, I think, the areas of education, family support, food and nutrition or meal service, health, and professional development. At least now, those are the 5 different categories that people have shared with us how they're providing services. So I just wanted to share that with you all. The Q&A is regularly updated on our website as well. If you go to the DCYF landing page and then click on the COVID link that you'll find on our homepage, and then you can click on the left-hand column where it says ECAP. Now, I think the guidance that Karen sent out on Friday is not yet updated on the website, but it will be soon. So if anybody has any questions, continue to send them to us. We will continue to update our Q&A. And we do have a couple of questions that we're still waiting on answers with, and have reached out to partners in order to answer those questions. So thanks for keeping those questions coming, and let us know if you have any more.
So Nicole, I know that there's a lot of interest, and we've been advocating around ECAP summer program, since we're going to be doing that in Head Start. And I know you guys sent something out to directors last week. What's the timing, and is there any initial thinking around summer services for ECAP children?
Yeah, I think we'd have to do a little bit, we're going to have to talk a little bit more about that. I think the biggest barrier and concern for being able to do summer programming in ECAP is the funding. Seeing as we might not have the same level of funding that the federal government is doing. But I think we will continue the conversations. And I don't know that in the Q&A document we have, or in the email we answered any, or provided any information on initial thoughts around around any summer programming. But we'll continue to think about that and see what might be possible.
Yeah, and just to so you and I are also talking, just to let everybody else know, about setting up some sort of a webinar around childcare subsidy for ECAP and Head Start folks, so that we're all on the same page around what those rules are and what we need to do, right?
Yeah, potentially. I mean, at least we want to be able to, find out a way that we can get people's questions answered and some better clarity in the field. And so I'll reach out to our colleagues in the child care subsidy department here at DCYF, and Karen and I can help field questions, or we can have a check-in call, or whatever is might be able to answer people's questions quickest or best.
Thank you. And I really liked the summary of all of the work that all the ECAP folks out there are doing. It was really helpful. In our check-ins last week, I talked to a number of teachers who were considering starting to do interactive Zoom type things for students. And so I did want to let everybody know that that is not as easy as you think. And Maricela and I have learned a lot about interactive events with 4-year-olds. And so tomorrow, I think, or maybe it's Wednesday, I'm doing a Learn Zoom with Katie webinar to give people who are going to be hosting Zoom meetings a little bit of a tutorial about some of the tricks and drawbacks of that platform in an interactive setting. So, so that is possible. Thank you, Nicole.
Yeah, can I say one last thing too, Katie, really quickly, is that people have also been starting to email us some pretty cool stories about what's happening in their communities. I mean, we clearly have the modified services, plans that contractors have been sending in, but in addition, they've also been sending in stories to highlight what, how necessary these services are. And what an impact it's making during this time. And so we're working on synthesizing some of those, and hopefully being able to share some out. So if you have any additional stories, let us know. Email Karen, email the ECAP inbox.
I really love that. And if you're sending them to them, just put Joel's or my email on that as well, and share it with us. And you know what we would also like? We would like photographs. So if you happen to be, putting together packets, or you are, visiting kiddos' houses or whatever and saying hello, or, doing something, take a picture of it and send it our way with your story. We would love to be able to do the same kind of documentation
Yeah.
for both
Well,
ECAP and
because
Head Start.
this is Joel. I'm thinking about Claire, who's out there, and as Claire said, there's a lot of focus on the childcare angle, right? I mean, I think, but the amount of work that ECAP programs and Head Start programs are doing to make sure that the most vulnerable families are still getting a pretty high level of support, and those kids are getting that level of support. We need to have a report or documentation that we can bring to Claire that she can talk about this and say, look, ECAP should actually get a boost of funding. They're doing all this support work with these families at home. Many of them are still operating some childcare options. The other thing is sort of a roll-up of data. Like, I think it would be helpful, Claire, you can tell me if I'm wrong or right, but you would be able to say in Federal Way, here are some examples of stories of modified services, but here's also some data. They've done X number of visits. They've done X number of, sometimes those kind of data points can be useful too, along with the stories.
And I think the more you can go outside school district systems, the better, I'm just going to say, because I think school districts have access to resource. They also have leverage service perhaps, and their employees have to work because they're paid on the 180-day, or they're paid on however many hours on a contract that they will continue to be paid. And if they're not doing service to kids, they'll be paid to do professional development. The same is not probably this for our nonprofits and for our community organizations, perhaps, that are still providing service. And I may not be right on that, but think about, again, not those that are closest to resource, but programs, and whether you're part of, CHS, whatever your organization, that may be a better sell. And the only other thing I'm going to say is keep your eyes open for a grant program coming out of Small Business Association for nonprofits.
Yeah.
Because of COVID.
Thanks, Claire. I just have a couple more things before we close. One is in the chat, I shared about our partnership with Region 9. I forgot to put it into this week's email, but we have a partnership with Region 9 and continueed.com, which provides early childhood courses with STARS credit. There's some special deals for Washington Head Start and ECAP providers, so you can check that out. The other thing is the census, and I want to just make a suggestion that one of the things that your family support folks might want to put on their list is the census and getting everyone counted if they haven't done it already. And then finally, I'm looking over here at the chat, and Lynn Harlington, who's with ESD 105, says we're trying to do policy council this week through Zoom with parents from Head Start, Early Head Start, and Migrant Seasonal Head Start parents. Parents are excited to try it. We will practice with families on Tuesday night and then have the meeting on Thursday night. That's really great. And I will say to all of you that Children's Home Society has been doing this for years. So you might want to talk to them about how they've made it work. And it could be that we, if there are challenges around some of these things, that we might want to find some experts out there among the field, and we would be happy to host a Zoom meeting on specific topics like that. So if you have any suggestions that would be particularly helpful to you on focused topics, just send them our way.
Katie, this is Fatima. Just real quick comment on that. We're gonna do it tonight or today, or PAC meeting. And so we are trying to serve everyone. So we have to do a dual language. So we're copying Maricela.
Yes.
Yeah, thank you for that. So if anybody thinks about this, have to provide interpretation, maybe they can talk to you guys about it, how Maricela does it. It's kind of tricky.
Well, it's tricky for us, but now I see from Erica Newman, it could be that we could do this in an easier way. Erica Newman says, we're also doing a Zoom policy council tomorrow night We chose Zoom because of the separate channels for language translation. What this says to me is that I'm calling Erica after this meeting to find out what she means by that, because the way that we have been doing it over the years, and we have been doing interpreted Zoom meetings for a long time and conference calls, is that we have just set up a separate Zoom meeting, a separate Zoom account, and then one of them, so there's separate registration for the Spanish and for the English. And so the Spanish speakers are over on a session with Maricela, and we make sure that PowerPoints are translated in advance so that she can be working with those. But if there's some other option here that I don't know about, I'm excited to hear about it. So, yeah.
It's Erica. You can set it up for language translation. So people can then be on separate channels. They'll still hear the English unless they choose not to. And so I think we have 5 languages that are going tomorrow night. It depends on the number of participants. And then they can choose their channel. They can choose to hear like me speaking at 20% and the other person doing simultaneous at 80%, or they could just hear it at 100%. But I, speaking in English, only hear myself.
Hey, Erica.
We've tried it out.
Erica, is it a live person doing the interpretation? Okay, yeah. So that's what we're gonna do. I was just wondering if you had something magic.
We magically have staff who speak all the languages.
Great,
Yeah,
great.
I wonder if you do not have the $16.95 Zoom approach that we have at our office. You may have
You have to pay more. You either have to have a business account or you have to have the webinar add-on.
Okay.
And then they'll add language translation to your account. So then people can choose the channel they want to be in too, or you can assign participants.
Yeah, well, so we'll totally take a look at that. All right. Anything else for the good of the order, you guys?
I just want to say, Maricela, my hat off. She does great with interpretation. And so we're going to try today, see how that goes. Excellent.
And you might even be able to hire Maricela if to do simultaneous interpretation. She has a business account, and that is how we get all of our interpretation done. So let me just put that out there.
And the other thing I would add is I think my wife might have been able to fix the door. So that's another accomplishment during this 1 hour. Well, that's a good thing too. I wouldn't have been able to either get out or in. So that was an unusual problem. So.
And Sally Gundry says that through TechSoup, you can get a discount on the Zoom thing. And Melissa McFeeters has supplied the helpful links for Zoom on the interpretation. So.
Yeah, one thing before we close, Katie, I'm wondering, it was absolutely terrific having Claire and Nicole on this Zoom call. Who else would be useful to have next week on our call? And everybody's invited, of course, but are there some recommendations of people that you think would be helpful to have us join next Monday? Just kind of wondering.
Senators or reps from around the state.
It was really helpful having Claire on to give some perspective. I'm assuming people might be interested in hearing DCYF's childcare subsidy person. Maybe Jason would be.
Yeah, we'll work that out to see if we can figure that out, and we'll probably do it separate from this call.
Okay.
Yeah. Well, thank you, everybody. Somebody from DSHS, SNAP, TANF.
Yeah.
Yep.
I'm talking to those guys tonight too for another thing I'm working on.
All right.
Yes, please, a subsidy person, Rika. Yeah.
Yep.
How about Northwest Immigration Project?
Yeah, that's a great another great suggestion. Absolutely.
Yeah, good idea. All right. Well, thank you, everybody. Have a great week, and keep up the good work.
Yeah. I have a feeling we'll see a lot of you tomorrow on Senator Murray's staff call.
I hope so.
We'll see you then.
Thank you,
Job,
bye.
Katie.
Thanks, everyone.
Thanks, everybody.
Thanks all.
Bye. Bye, Claire. Thanks again.
Bye-bye. Take care, y'all.